Triangle, very good, okay? You have major in blue, and then right above it is minor. You won't ever be able, you won't be able to differentiate the two of them. Okay, so we're going to palpate them as one. But literally, it is from the medial border of the scapulae to the vertebrals to the spinous process. That's it. I mean, so it's right here. Right here. How easy is that? All right, and you can see it basically just runs the length of the vertebral border. So almost a little bit superior angle all the way down inferior angle. So really, really easy. How do you get rhomboids to fire? Retraction. So I typically go to my patients, what's your favorite type of fruit juice? Orange. You have an orange between your shoulder blades. Make orange juice. There it is. They can get that, okay? They understand that concept. You'll find out when you work with clients and patients that they typically are dumb, so you have to give them some suggestions like that. Oh, don't act like they're not. You guys have more than one occasion met someone like, how do you not get this? I literally just explained it to you. All right. Now we're going to do our anterior palpation. So we're going to start in a supine position. This is Pectoralis Major. Okay, Pectoralis Major. You can see the origin of Pectoralis Major being on the sternal body. If you're palpating a female, obviously with breast tissue, we need to be respectful. So you don't need to palpate, don't palpate. It's going to run right underneath the breast tissue. So for our purposes, if you can palpate the sternal body right there, that's basically the origin. Okay? Good? You can see that it's going to trace basically straight across. So it's going to come straight across and then insert pretty low on the humerus. Right here is going to be Teres Major and latissimus dorsi, and up here are the tubercles. So we're pretty low on the humerus, agreed? More than you think. And the fiber's going to be basically straight across. You're also going to notice that this does not touch the scapulae. Pectoralis Major has absolutely nothing to do with the scapulae. Has a little bit of clavicular, a lot of sternal, comes straight across to humerus. All right, we can actually palpate it relatively easily right here in the axilla. You can grab it right there. That soft spot, you just come right in this area right here. You can feel it. That's Pectoralis Major right there. Big, huge muscle. All right, so for our purposes, again, females, be careful. If you're palpating right there in the sternal body, hover, and then palpate into humerus. Make sense? To actually test this muscle, lock your elbow out, palm towards that way. We're going to ask her to bring her hand straight across, and you're going to feel that's Pectoralis Major firing. Right, really good Pectoralis Major. You want to get the lower fibers, thumb. We're going to ask her to pull her thumb down to her opposite hip, and you're going to get the lower fibers.
Overestimating my strength.
Yeah, you don't need to. In this position, the patient has very, very little leverage. You can very easily break them in terms of making them move. So very, very good Pectoralis Major upper and lower fibers, if you want to test them. Question on Pectoralis Major. Its little cousin is going to be way over here. This is Pectoralis Minor. Pectoralis Minor. You can see completely different orientation. It's almost like a vertical muscle now. Agreed? But these three muscles are all on the same slide because they all share a common spot on Coracoid Process. Remember that Coracoid Process is the anterior projection of scapula, right? So if you can palpate Coracoid Process, you got three muscles. Congratulations. So we're in the far left here of Pectoralis Minor. So what you want to do, again, right on the ribs in that breast tissue, so you're just going to kind of hover your hand. You can palpate coracoid right there. Okay, that makes sense? So my finger is on the coracoid. Agreed? Yeah, I'm just looking at her facial expression. Yeah, my coracoid. All right, and I understand that the origin is coming down that way. All right? Pectoralis Minor, what action does it do? Does the Shakira or the Beyonce? I can't do it, but it's some sort of like shoulder thing action, which I can't do because I'm old and a dad, and apparently I lost all that. I could never do it, really. But it's the ability to lift your shoulder up off the table and back down. Because remember, you're pulling the shoulder forward. You're pulling that coracoid process forward. Does that make sense? So think about your typical college-age person here, right? That pectoralis minor is wicked tight. It pulls the coracoid, which rolls their scapula forward. You kind of see how that happens? So what you have to do, you have to stretch pectoralis minor, open up the anterior. Really, really good pectoralis minor stretch. Put like a towel or a foam roll take the heel of your hand, find those coracoid processes, and just push down. Right? You push that coracoid process posterior, it opens up your entire anterior chest. It's like, oh my God, I didn't know that was possible. But tied to some scapular release, a good pectoralis minor stretch. Just throwing that out there, all right? Does that make sense on how pectoralis minor works? Pectoralis major, pectoralis minor. Good? All right, let's go and do those muscles. Here we go.